Alright, so we're going to start with the scan of the environment. And then the scan of my ears. Alright, so now we're going to start the assessment. So hey, my name's Meredith. I'm a nurse practitioner student. I have just washed my hands and I'm going to start a head to toe assessment on you. Is that okay?
Yes.
Okay, so I'm going to maintain your privacy throughout this exam. So if you are uncomfortable at any point, just let me know. Alright, so the first thing I noted when she walked in is she walked in with a steady gait. Her coordination is good. She has on clean and appropriate clothing. She appears to be in good health. No signs of distress noted. She's in clean and appropriate clothing. Her hygiene is very good. I don't notice any body odors coming from her, any breath odors. And then I'm looking at her skin. It's appropriate for race. Also, her sexual development is good for her age and her gender. And then I've already noted your vital signs, and they are appropriate for your BMI is appropriate for your height and your weight. And then all of your vital signs were normal. So I'm going to start by assessing the skin. When I'm looking for the skin, I'm looking at the color, I'm looking at the turgor. I'm going to note any bruises, lesions, lumps, redness, rashes, birthmarks, or tattoos. So then I'm going to look at the nails. When I look at the nails, I'm looking how pink they are, which they're good pink. They have good color, good capillary refill, less than 3 seconds. And then I didn't notice any clubbing or cyanosis. And then I'm also looking at your hair. I look at the hair distribution. I don't see any obvious hair loss. Hair is equally distributed through the body, so that's good. Can you tell me who you are?
Megan.
All right, and then where are you?
Andalusia Hospital.
Okay, good. All right, and what's today's date?
April 13th.
All right, good. So the patient's oriented to person, place, and time. So my general survey of you looks very good. All right, so now we're going to move on to the head. So when I assess the head, I'm looking at the hair and I'm looking at the scalp. I'm going to look for any scaling of the scalp, any lesions, anything like that. So I'm going to also palpate the scalp. When I'm palpating, I'm going to note any deformities, lesions, masses, anything like that. So I don't notice anything. Her hair is soft, it's long, it's like brownish blonde in color. So your hair looks really good. So now I'm going to look at your face. I'm looking at the symmetry of the face. It looks very good. So I'm going to assess cranial nerve 7. So can you raise your eyebrows for me? Okay, good. Now smile, frown. All right, now puff out your cheeks. Now show me your upper and lower teeth. All right, great. So cranial nerve 7 is intact. So now I'm going to assess cranial nerve 5 with the temporal and masseter muscle. So what I want you to do is I want you to clench your teeth together. All right, so that is symmetric. So that's very good. So that's intact, cranial nerve 5. So now I'm going to look at your temporal and mandibular muscle. So can you open and close your mouth, or joint, I mean. There you go. Good, that joint is intact. Was there any pain? Good, I didn't notice any crepitus either. All right, so now I'm going to look at your sinuses. I'm going to palpate those. Are those tender?
No.
Okay, good. So now I'm going to percuss. All right, were those tender?
No.
Good. Now I'm going to move on to your lymph nodes. I'm going to start with the preauricle, postauricle, the parotid, the tonsillar, the submandibular, the submental, the anterior cervical, posterior cervical, occipital, and then also the supraclavicular. Going on your shirt for those. All right, good. Were those tender?
No.
Good. Those are non-tender and non-palpable, so that's normal. So now I'm going to move on to the eyes. When I start by assessing the eyes, I'm looking at your eyebrows, your eyelashes, and your eyelids. Eyebrows and eyelashes, you have good hair distribution. I don't see any obvious hair loss, so that's good. Your eyelids, I'm not noticing any ptosis, redness, drainage, anything like that. Can you close your eyes for me? Okay, good. The eyes close completely and symmetrically, so that's very good. So now I'm going to look, I'm going to palpate right here. All right, is that tender?
No.
Okay, good. So the lacrimal duct is non-palpable and non-tender. So now I'm going to pull down the eye, and what I'm looking at is I'm looking at the sclera. It's white. The conjunctiva is pink. The cornea is dome-shaped, translucent, and smooth, and then the iris is flat and green. All right, and I can notice that you have a contact lens in. So now I'm going to assess cranial nerve 2 with the Snellen chart. So you do have contacts in, right?
Yes.
All right, so for this test, I'm going to have you keep those in. So for this test chart, I would stand 6 feet away. And I'm gonna have her read the lowest line possible, but for video purposes, I can't be exactly 6 feet away. So read the lowest line possible.
LTFPH.
All right, good. And I would have her do that with one eye, the other eye, and then both eyes together, and I would compare. So she read the 2020, the line that corresponds with 2020. So that means she can see 20 feet away, and she has very good vision. And it is corrected, so that's good. All right, so now I'm going to assess cranial nerve 2 again with confrontation and peripheral vision. So I'm going to stand in front of you, and I want you to cover one eye. All right, and then I'm going to cover my eye that's equal to yours. So I'm going to hold my fingers out, and I'm going to hold up a number, and I want you to, without breaking eye contact, tell me how many numbers I'm holding up.
2, 2, 2, 2.
Okay, good. So peripheral vision and confrontation is intact, so that's very good. Now I'm going to assess cranial nerves 2, 3, and 6. And I'm going to do this with the cover test, the point of gaze, and the corneal light reflection. So let's start with the cover test. I want you to cover one eye and then uncover it. Now do the other eye. Cover one eye and then uncover it. Okay, good. I didn't note any deviation, so that's good. So now we're going to do the point of gaze. So I want you to follow my pen light with just your eyes. Do not move your head. All right, point of gaze is intact, and I could do that with each eye and then both eyes together. So I'm also going to assess your accommodation, so just follow. There we go. Perfect, so accommodation's intact. So now I'm going to do the corneal light reflection. So I just want you to look straight ahead. I'm going to shine this light in between your eyes. All right, good. What I'm looking at is that both corneas react, so corneal light reflection is intact. So now I'm going to assess cranial nerve 2 with, I'm going to do 2 and 3, excuse me, with, by checking your eyes again. I'm looking to see that, I'm looking at your pupils, so just look straight ahead for me. And I would do this in a dimly lit room, but these lights don't dim, so, but I would do this in a dimly lit room. But your pupils, they're equal, they're round, they're reactive to light and accommodation, so that's good. So now I'm going to do assess cranial nerve 2 again. This is with the ophthalmoscope exam. So I'm going to be getting kind of close to you. And then I've already adjusted the wheel to match mine and hers vision. So right now it's set at 0. So I'm going to hold the back of your head. And I just want you to look straight ahead for me. So I'm going to rest my hand on your face, and I'm going to get kind of close. So what I'm looking at is I'm looking at your retinal background. It looks to be uniform in color, so that's a good sign. I'm also looking at the red reflex, which is present. And then I'm looking at the macula and the fovea. I see those, they're present. I also see the blood vessels, they're red and they're visible. And then your optic disc was round, it's pink with sharp edges. So your internal eye structure looks very good. So now we're going to move on to your ears, and I'm going to start the ear assessment by assessing cranial nerve 8. So what I'm going to get you to do is I'm going to get you to close this ear, and I'm going to stand behind you, and I'm going to stand 2 feet away, and I'm going to whisper some things to you. This is called the whisper test. So I just want you to repeat them. 1, 2, 3. 1, 2, 3. Good. All right, now close that ear.
ABC.
All right, great. So whisper test is appropriate. So now I'm going to use this tuning fork, and I'm going to assess the Weber test. So this assesses sound lateralization. So what I'm going to do is I'm going to strike this tuning fork, and I'm going to place it on top of your head, and I want you to tell me if you hear it in both ears or if you only hear it in one ear. All right, and then which ear you hear it in. Both? Okay, good. So that's a normal finding, so I'm hearing it in both ears, so your sound lateralization is good. So now I'm going to assess air conduction and bone conduction. So this is called the Rhine test. I'm going to strike the tuning fork. I'm placing it behind your ear, and I want you to tell me when you stop hearing it. And I'm going to place it next to your ear, and I want you to tell me when you stop hearing it again.
Stop.
Okay, great. All right, so the Rhine test is good because air conduction is greater than bone conduction. That's why you can hear it longer next to your ear. All right, so now I'm going to assess the external ears. What I'm looking at is I'm looking at the external ear, looking for any drainage, any nodules, any swelling, anything like that. Inflammation, I don't notice anything. I'm also going to feel the arcals and then just the external ear. I don't feel anything, I don't see anything crazy. So Now I'm going to look inside of your ear canal. I'm gonna test this. All right, so what I'm gonna do is I'm gonna pull up and back on your ear. All right, so I'm looking in the ear canal. All right, and I can see some hair, there's some yellow earwax, and I see your tympanic membrane. It was gray translucent and it reflected a cone of light, so that's completely normal. So your ears look great. So now I'm gonna move on to your nose. When I assess your nose, I'm just looking to see that it's midline. I don't see any abnormalities with it. Is this tender? Is this tender?
No.
Okay. All right, so no tenderness noted. So that's good. Can you close one nostril and breathe through your nose? Okay, good. Now do the other side. All right, good. I don't see any kind of congestion. She doesn't seem to be stopped up. So now I'm going to look inside of your nose again. All right, so just tilt your head back for me. When I look in your nose, I'm just going to look for, I'm looking at your nasal septum. It's midline. I see your turbinates. They're pink. They're not enlarged. All right, and the mucosa is pink, moist, and intact. So then I would look at both nostrils, and that's a complete that's a normal finding. And then also I didn't state that whenever I was doing her ears, I would look at both too. Sorry, I forgot that. But now I'm going to assess your cranial nerve 1. So this is going to be your smell. So I want you to close your eyes. I'm going to give you something to smell, and I want you to tell me what it is.
Peppermint oil.
Good, and this is peppermint oil, so that's great. So that looks very good. So now I'm going to move on to your mouth and your throat. So when I'm looking at your mouth, I'm going to start out by looking at your lips. They're pink, they're symmetric. I don't see any dryness, cracking, anything like that. They're very moist, that's good. So now I'm going to look inside of your mouth. So I want you to open your mouth wide for me. So what I'm looking at is I'm looking at the oral mucosa. I'm also looking at the teeth. I don't see any dental caries, nothing like that. Let's see, I see the palatine and the buccal tonsils. Now, can you stick your tongue out for me and say ah? Really wide. So I see the tonsils in the back, they're not enlarged. I see the uvula. Say ah one more time again. Good, it moves with phonetation. That's cranial nerve 9. Your tongue was moist and pink, so that's a good sign. So I'm also going to assess cranial nerve 12 now. This is with tongue movements. Can you stick your tongue out? Okay, good. Now move it side to side. Good. Now stick it to the roof of your mouth. All right, great. So you have cranial nerve 12 is intact. So now I'm going to have to do your gag reflex. This is your cranial nerve 10. I know it's going to be a little uncomfortable, so I want you to stick your tongue out. All right, and then good. Gag reflex is intact. All right, so that's good. And then also when the patient she articulates with a clear voice, so that also tells me that cranial nerve 5, 7, 10, and 12 are intact. All right, so now we're gonna move on. I'm gonna move on to the throat, or the neck, excuse me. So when I'm looking at the neck, I start by looking at the skin. I don't notice any skin tags, redness, lesions, rashes, bruises, anything like that. So I'm also gonna feel all over the neck for any kind of lumps or anything. I don't. And then I'm gonna feel the trachea. Trachea is midline. So now I'm gonna come behind you. And I'm gonna feel behind your neck, and I want you just to swallow for me. Okay, good. So that, your thyroid is not enlarged. I didn't notice any goiters, nodules, or anything like that. So that's a normal finding. So now let's do some little bit of range of motion of your neck. Can you just tilt your head back and forward for me, and then side to side? And then just go kind of around with it. Okay, awesome. The range of motion looks very good for your neck. So now we're going to assess cranial nerve 11, and I want you just to shrug your shoulders against my resistance. Good. Now turn your face towards my hand. Good. And again. All right, good. Cranial nerve 11 is intact. All right, so now I'm going to move on to the thorax and the breast. So I would normally do this with my patient with her shirt off, but since this is going to be on YouTube, I'm not going to do that. So the first thing I would start by assessing is I would assess the skin of the thorax and the breasts. Look for vascularity, color, bruises, nodules, anything of that sort. I don't notice anything like that. So now I'm going to get you to just deep breathe a couple of times. So just take some deep breath. Good. And again. All right, good. So her APA ratio looks to be about 1 to 2, which is normal. I don't notice any barrel chest or anything like that, so that's a good finding. And then the breathing's symmetrical, it's unlabored, it's regular, so that's good. So now I'm gonna move to the back. Let's go with me. So now I'm gonna move to the back, and I'm gonna do the same thing with the back. I'm gonna assess the skin, look for any abnormalities. I don't see anything. So I'm also gonna assess her breathing back here, look for the symmetry and anything like that. So then I'm gonna start, and I'm going to palpate. So what I'm gonna do is I'm just kind of palpating the intercostal spaces and the ribs. So I go all the way down. I'm just feeling of those. When I get to about the 10th rib, I'm gonna get her to breathe in and out a couple of times. So breathe in and out. Good. And what I'm feeling for is that muscle expansion, and it is symmetric and equal, or symmetric and strong, so that's good. All right, so now I'm going to check for tactile firmness. So what I want you to do is say 99 a couple of times for me.
99.
Good, and again.
99.
Good, and again.
99.
And one more time.
99.
All right, great. So what I was feeling for was that vibration, and I was comparing one side to the other. So that's very normal. So now I'm gonna get you just to lean forward for me. So, and I'm just gonna kind of feel of your spine. And then, like I said, she would also be shirtless for this, and I would look at her spine, and I would feel of it. I don't notice any kind of scoliosis, kyphosis, lordosis, anything of that matter. So now I'm going to percuss, and I would percuss each of the lung fields. Is there any tenderness?
No.
All right, good. So now I'm also gonna feel this area. Is there any tenderness down here?
No.
All right, so this would be CVA tenderness. And I'm also going to percuss. All right, and then you would never do this with them standing up, or they might fall. All right, so no CVA tenderness down there. So now I'm going to listen to you. All right, so just take some deep breaths for me. Deep breath. Good. In and out. Good. In and out. All right. Again. 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 All right. Again. And again. All right, good. Her lung sounds, they're clear, they're equal through all the lung fields. I didn't notice any wheezing, rhonchi, anything abnormal like that. So then I would also do all of that to the front too, but for video purposes, I'm only doing one side of the body. All right, so now I'm gonna move on to the breast. Like I said, for video purposes, since this is going on YouTube, I'm not going to actually do this, but I am going to teach you how to do this at home. So this could be a self breast exam. What you'll start out with is inspecting the breast. You'll kind of look at them, you'll compare them, make sure they look about the same, make sure one's not extremely larger than the others. You'll look for any kind of discharge, swelling, redness, lumps, lesions. So then when you start assessing, when you start palpating, you're going to use the pads of 3 fingers, and you're going to start at the alveolar, which is your nipple, and you're going to slowly go out in a circular motion, and you're just going to go very slowly all the way out, and you're going to feel the entire breast from the clavicle all the way to the abdomen. And then another thing you'll want to kind of feel of is you'll want to feel these axillary lymph nodes right here too for any swelling or tenderness, which you don't have any, do you? Okay, good. And then you want to just make sure that you do the alveolar, the subalveolar, and the tail of Spence, which is kind of like right here. All right, so that's how you would do a breast exam. And then when you inspect your breast, you'll kind of want to inspect them sitting down, and then you could do it laying down with your arms over your head. So, all right, so now we're going to move on to cardiovascular. So what I want you to do is I want you to lay down for me. All right, so I'm going to start my cardiovascular exam. I want you just to kind of look that way. So what I'm looking for is I'm looking for a jugular vein distension, any pulsations. I don't notice any. I would assess both sides. So now I'm going to feel for her carotid pulse. All right, and she's got a good carotid pulse. It's a +2. So now I'm going to auscultate it for any bruits. Okay, good. And then I'm going to do the temporal artery. Okay, good. And then I would also assess the other side, and I would compare. So that's very good. So now I'm just going to feel up each of the cardiac spaces. So since I've already kind of assessed the skin right here, I'm going to skip over that. So I'm going to fill up each cardiac space. I'm going to start with the aortic. Okay, and then I'm going to move over to the pulmonic. And then this is your Erb's point. And then it would go to the tricuspid. and then the mitral. And the mitral is your point of maximal impulse. So now I'm going to listen over those, and I'll be listening over them twice. Once for my diaphragm. Good. Then I'm going to do it with my bell. And what I'm listening for is I'm listening for any kind of like murmurs, any extra heart sounds. I hear S1, S2 with you, which is completely normal. So that's good. And then I would also note any intensity, but I didn't hear any murmurs, any clicking, splitting, anything like that. So that's good. All right, so now I'm going to assess your pulses. I'm going to start with your radial pulse. Good, your radial pulse is a +2. Then I'm going to do your popliteal. All right, that's a +2. Your posterior tibial. All right, that's a +2. And then your dorsalis pedis. And that's a +2. So all of your pulses are a +2, so that's very good. And then I'll also do the other side and I would compare them. All right, so now that I got you laying down, I am going to start my assessment on the musculoskeletal. So I'm going, oh, not musculoskeletal. I'm going to do the abdomen. Sorry, I almost forgot this. All right, so I'm going to expose your abdomen for this. Just lay your arm down for me. All right, so I'm going to just start out by inspecting. I'm looking at the skin. I'm looking for any bulges, masses, anything like that. I don't notice anything. So then I'm going to auscultate. So when I auscultate, I'm just kind of listening to all of your bowels. So I'm going to listen to all 4 quadrant. I'm just listening to your bowel sounds. And you can listen up to 5 minutes, but you can kind of hear hers. All right, good. And then I would listen to the aortic. Good. And then the femoral. All right. And then I'm also listening for any other kind of vascular sounds, bruise, anything like that. All right, so now I'm going to percuss, and I'm going to start over your liver, and then, sorry, I know you're ticklish. All right, so you hear that as kind of some dullness, which is completely normal to be heard over the liver. Then I'm going to move over here to your spleen. All right. The spleen is difficult to percuss, but that's completely normal. So now I'm going to lightly palpate your abdomen, and I'm going to start going about 1 inch in. I'm going to note any masses, lumps, lesions, anything like that. Is any of this tender? I don't notice any tenderness guarding. So now I'm going to go ahead and start deeply palpating. That's going to be about 5 to 8 centimeters. I'm going to try to identify those underlying organs, notice any fluid, anything like that. So is any of this tender? All right, good. So she has no tenderness, so that's good. Your abdomen feels great. So now we're going to move on to musculoskeletal. So with musculoskeletal, I'm going to start, since I've got you laying down, I'm going to go ahead and start with your lower extremities. Normally I would start at the shoulder and work my way down. So with the lower extremities, I'm first going to start out, feeling of your inguinal lymph nodes, so I don't feel them. They're non-tender. She's a little ticklish. I'm also going to feel the femoral pulse. It is a +2, so that's good. So I'm going to feel the hip. All right, we're going to start with range of motion, and then as I'm doing this, I'm also assessing the skin and looking at it. So what I want you to do is I want you to bring this leg out. Okay, now cross it over. All right, good. Now bring it up to you. All right, and then bring that knee out while it's up there. Okay, good. So she has good range of motion of that hip, and then I didn't feel any crepitus, anything like that. So we're going to do the same thing with your knee. So bring that knee up, then down, and then kind of rotate it out. Yeah, there we go. All right, so knee feels good. So now we're going to do the ankle. So just kind of rotate your ankle back, and then point your toe, and then kind of go side to side, and then around. Good, no crepitus, nothing like that. All right, so what I want you to do is I want you to push against me like you're pushing a gas pedal. All right, good. Now we'll pull against, good. So you got good muscle strength there. So those are a 5 out of 5. Now pull against my hands, or push against them, sorry. And then go down against them. Good, so that's good muscle strength, which is a 5 out of 5. So now I'm gonna get you to sit up. So now I'm gonna start and do up here, so now that she's sitting up. Alright, so I'm feeling to the shoulder, and then like I said, I'm also assessing the skin on the upper and the lower extremities. So I'm feeling to the shoulder, so I want you to kind of bring this arm out. Alright, now go up above your head. Now kind of go behind your head. Alright, good. Now go behind your back. Alright, good. And can you just rotate your shoulder around for me? Alright, good. She's got good range of motion over her shoulders. Now we're going to do the elbow. So kind of bring your elbow in and out. Alright, good. Now kind of like twist it around. Yeah, like bring it around. Alright, good. Good range of motion of the elbow. No crepitus noted. So let's do the wrist. So back and forth, and then kind of just go around. Good range of motion of the wrist. Alright, so now the fingers. I don't feel anything abnormal. No swollen joints. Now just spread your fingers out like this. And then just wiggle them for me. Alright, good. So I want you to squeeze my hands. Alright, good deal. And then I want you to push your arm up against mine. Alright, good. Now go down against it. Good. So muscles are 5 out of 5 in these upper extremities, and then I'll also assess the other side and I would compare them. All right, so that's it for musculoskeletal. So now we're going to move on and we're going to go to neurological. So with a neurological assessment, I've already assessed her cognition, her mental status. She's oriented to person, place, and time. I haven't noticed any flood of ideas or repetition. Her judgment has seemed to be very well. So I'm going to ask you a couple things for your recent and your remote memory. So what did you eat for breakfast this morning?
Pancakes.
Pancakes, that's good. So what elementary school did you go to?
Charles Henderson.
Okay, so that's good. Recent and remote memory is intact. So now I'm going to give you something, and I'm going to get you to put it in your hand, and I just want you to identify it by closing your eyes and just identify it by touching it.
A key.
Good, perfect. So that is a key. All right, so that was very good. So next I'm going to assess your sensation. So what I'm going to do is I'm going to touch you with something, and then we're going to assess sharp, and we're going to assess dull. All right, so I want you to close your eyes and tell me which one I'm doing.
Sharp.
Okay.
Dull.
All right, now I'm going to do it on your leg.
Sharp. Dull.
Good.
Sharp. Dull.
Okay, good. So sharp and dull is intact. All right, so now I'm going to do the 2 pinpoint. So I'm going to either do 1 or 2. All right?
1, 2, 1, 2, 1, 2.
All right, good. So 1 and 2 pinpoint is intact. And then I could also do this with temperature, vibration, pain, and hard and soft, but I'm going to defer that for video purposes. But I could go more into depth with that. So now I'm going to assess your coordination. So what I want you to do is I want you to put your hands on your knees, kind of like this, and just flip them back and forth like this. All right, now do it as fast as you can. Okay, good. So now I want you to take this heel and I want you to run it down this shin. Okay, good. Now do that with the other foot. Okay, good. And then now I want you to put your hand or your finger on your nose, and I want you to touch my finger and then go back to your nose. Good. Now do it again. Okay, good. So it seems like your coordination and your motor function is good. All right, so now I'm going to assess your reflexes. So I'm going to start with your brachial radial reflex. Good, the reflex was there. So now I'm going to, just curl that up. So now this is your biceps. Okay, good, and you can see that muscle constrict. All right, so now we're going to do the triceps. Okay, good, so you can see it back there. So now I'm going to do your knee. All right, good reflex with that. So now I'm going to do the Achilles. All right, and you can see it. So the reflexes are good. So now I'm going to do your Babinski reflex. All right, so no fanning of the toes, so that's a normal finding. Then I would also do the other side and I would compare. So now I'm going to test your balance, so please stand up for me. All right, so what I want you to do is I just want you to kind of stand right there, and I want you to cross your hands and just close your eyes. All right, good. So this is the Romberg test. She's not doing anything. So I want you to turn now and walk. So walk. Okay, now walk back on your tippy toes. Okay, now walk back heel to toe. Okay, now hop on one foot for me. And then hop on the other. All right, that's everything. Thank you.